Okay, this is a mock counseling session for a class, and so it's not really a counseling session, it's just for educational purposes. All right, so thank you, Myrna, for coming today. And so, just I know this is one of our first sessions, so kind of want to set an agenda of how the session is going to go. Um, First thing we'll do is just kind of do a mood check, see what's been going on in the last week, and then since we did an evaluation, so what's been going on with you? Anything like what's going on this week for you?
Well, I'm not having too good of a week. Um, uh, you don't really. I'm having some issues with my right arm, and I'm gonna have to have surgery. Um, Shoulder replacement. I've been in a lot of pain, and I'm having to rely on my kids for help, which that's not normally my MO. It's usually the other way around, where I'm there for my kids, and now I'm having to depend on them. And it really is kind of hard for me to do that, and I feel like my kids are um, not upset with me, but um, they don't see me the same way they used to when I was strong and I was able to tackle anything, and also with my COPD, I can't keep up like I used to. I guess this getting old is getting this. I'm not doing it well,
Mm-hmm.
and I feel like I'm not what I used to be with my kids, so that makes me depressed.
Mm-hmm.
So I'm having a hard time dealing with that.
Okay. So it sounds like because you've got surgery coming up, so your mind is probably. Would you say that you're maybe a little anxious too about the surgery coming up?
Yeah, I'm worried
Okay.
because a lot of things could go wrong.
Mm-hmm.
I mean, I'm really hurting really bad now, so I'm hoping that the surgery will um, take care of the problem and I heal really quickly and I get back to where I used to be. I know I'm getting older, so I'm slowing down. But
It looks like that you're pretty sad, discussing what's going on. So what's going through your mind right now that's causing you to have the tears?
uh, I just feel
Grab. Oh, so sorry. There you go.
sorry.
It's okay.
Maybe it's not the pain that I just get more and more emotional. I'm okay emotionally. It's just this getting old is getting it came on so quickly. I guess that's what you know. 2 years ago, I was able to do a whole lot more than I'm doing right now, and it
Mm-hmm.
came on really quickly. And I think sometimes that my kids get tired of, you know, helping me around. Like my son, he got married not too long ago,
Mm-hmm.
and I have a problem with stairs because of my COPD,
Mm-hmm.
and he was right there. Um, I had this railing on one side, and he was on the other side helping me like an old lady,
Mm-hmm.
and that kind of. I mean, he was being really kind to do that for me. Um, but then on the other side hand, I was going, oh my God, she's having this little old lady, and not just his mom, but this little old lady.
Mm-hmm.
So it made me feel really old. I guess I'm just having difficulty um, aging
Okay.
gracefully.
Okay.
But I'm hoping after my surgery that things will get better and I'll be able to get back to where I was. I had this huge weight gain
Mm-hmm.
because of the steroids and the inactivity and stuff. So I think maybe after the surgery I can get back to my nice normal self.
Okay. Okay. So the surgery, I think that it's for your shoulder, and that's what's
Mhm.
been causing you a lot of pain, which has
Uh-huh.
brought on your depression that you've
Yeah.
been going through. So so you talked about how you feel like you're not doing everything that you used to do, and that you feel like you're a burden to your children. Do they say anything that makes you feel that way, or is it just?
No, they really don't. They've been actually really crying. It's just something I'm not used to being the one that um, one that needs the help. I've always been all my life a caregiver for somebody else or my kids or wherever I'm needed. It's part of my job that I do is I work with people with disabilities. And so it's really hard for me to be on the shoe to be on the other foot. It's hard for me to be the one that is needing the caregiving.
Mhm.
It's usually it's been the other way around for so long.
Mhm. So do you feel like you're not able to care for your children like you used to before?
No, well, they're grown and they really don't need my care like they used to. But I mean, they used to always be able to come to me and I'd be able to fix or do stuff. And now, right, the last couple of years, I haven't been able to because of my illnesses and
Mhm.
stuff. So I'm hoping, like I said, I can get back to where I was. I know not 100% where I was, but better than what I'm doing now.
Okay. So the the you being sad kind of contributes to the feeling of inadequacy, but and this is just so it's things that are happening such as your son helping you up the stairs where you're not able to get up the stairs like you used to by yourself. It makes you feel like that you're not able to do what you used to do.
Mm-hmm.
Is there, I know with the surgery you're going to feel a whole lot better, and I think that's going to change some things for you. But is there anything that you can see, like, is there something that's happened, like maybe something specific that's happened that's caused you to feel, less than what you used to be? Like, or, I mean, I know you said your children have been kind, but, um, I don't know. Like, I guess kind of I'm trying to think of, um, the feeling that the thought that you have. So let me tell you about the cognitive model and the therapy that we're doing. So like something, things happen such as, having to be helped up the stairs by your son, and it gives you these automatic thoughts that you're not worthy or that you're not good enough, that you're not like you used to be. You feel kind of inadequate in the way that like you're not you're not as independent as you used to be, and that's a struggle. And so those thoughts creates this behavior where you feel sad. So what, looking at, you are able to get up the stairs, you're still able to move around. So instead of thinking that you're not able to do it, is there another way to look at it that, I mean, you could, I mean, let me think of where I want to go with this.
Well, I'm thinking my situation in some way can be fixed through surgery.
Mm-hmm.
Pain is so that the word. Um,
It's so harsh.
Yeah, it's
debilitating. Is what you're thinking.
That's the word I'm thinking.
Okay. Okay.
And it comes on you, and there's nothing you can do.
Mm-hmm.
I mean, it is what it is. So I'm hoping that once hopefully the pain will go away, a lot of the emotions will go away as well. I mean,
Mm-hmm.
this came on so it's not like it was a gradual process of the aging process. It's like in 2 years' time, all of a sudden, I went from being able to not run a marathon but walk fast and breathe easy, to struggling when I walk fast or if I do stairs and I have difficulty breathing, and then I have the pain in the shoulder and I can't. Dressing myself has become a real issue. My daughter has to help me dress myself because right now it's too painful to do
Mm-hmm.
that.
Mm-hmm.
I mean, I'm like an old person in a nursing home is what I'm feeling like.
Mm-hmm.
And I'm hoping, praying that the surgery will take all that away,
Mm-hmm.
where I'll be able to dress myself again.
Mm-hmm.
I think just being more independent again, that I can take care of myself again, without the help of making sure somebody's around to at least help me get my clothes on.
Mm-hmm. Well, let me ask you this. So, like, I know you said that your daughter helps you with putting your clothes on. Are there things that you can do by yourself that you don't require assistance of others? Such as, are you still able to drive?
I am driving, but it's only with the left hand right now.
But
so
you're able to get around, so you're still independent in that sense?
I can still drive, yes.
Okay.
I can still drive. To put the seatbelt on, that's another that I usually have to have
You need
somebody in the
assistance with
car.
that, yeah.
Because
Okay.
I can't push.
And then, are you able to do chores at the house?
Somewhat. I can't vacuum. I can't mow.
Mhm.
The pushing and the pulling on the vacuum or lawnmower.
So you require assistance on that. But are there some things that you still can do by yourself?
Yeah, there are a few things I can do by myself, but
Okay.
it's like I said, once again, I used to be able to do everything.
Right.
I'm gonna have to accept that there's some things I can't do anymore, but there's some things I'll be able to return being able to do once
Right.
once I get the use of my arm back. And it's my right side, so that's my dominant side,
Mhm.
so it's.
But there's still things that you're still able to do. Maybe you have to do them at a slower speed instead of the faster speed that you're
Uh-huh.
used to,
Yeah.
which is fine. It's not a race as
Right.
long as you're still active to get some things done.
Yeah.
Okay. So, uh, in planning forward, like, how can you feel that changing your thoughts? That I know you require assistance of your children sometimes, but I feel that possibly that they probably still seek your help for things as well, and you're still able to help them as well.
Yeah, they ask my advice on some things or
Mhm.
what I feel about some things, and that still makes me feel good.
Mhm.
Um, yeah, so, my kids have been actually pretty decent about it. I just don't want to become a burden,
Mhm.
and,
Well, I want you to. So one of your homework assignments that I would like for you to, like, maybe we could think about doing is that for this next week, just jot down, um, like the different type or different situations where your children ask you to help them with something, just to kind of show, because sometimes we forget all the things that we do, and we always think of how other people are helping us, but we forget of all the things that we've
Mm.
contributed. So I want you to just kind of make a list, and then we'll discuss that the next time you come.
Mhm.
Does that sound like something that you'd be okay to do?
Mhm.
Okay,
Yeah.
so that we can refresh on that. Um, then the other thing I wanted to talk about, and